This is Dr. Someshwar from Shield Healthcare. I hope everyone doing good. And I welcome you all on to the Menopause series by Dr. Payal Bhargava, a co-founder of Divine Magic Foundation. Before starting the talk, let me take privilege to introduce Dr. Payal Bhargava ma'am, who is a postgraduate diploma in ART from and reproductive medicine from Kiel, Germany. And she did her fellowship in infertility from IMA Hyderabad, and she is a life member of IMA Menopause Society India and PCOS Society India. She is a member of Managing Committee of PCOS Society India and co-founder and director on board XPS Analytics Private Limited, and consultant at Sri Krishna Diagnostic Center and also consultant at Pranada Hospital, Hyderabad. And she is a co-founder for Divine Magic Foundation, a public health and awareness initiative working at grassroots level and digitally through its YouTube channel.
And welcome all for our third in series of Sailing Through Menopause. Today, we are going to discuss a very important topic on nutrition in menopause. In the first two series, we have seen that how estrogen, which is a very important hormone for a woman's health, is stopped being produced by ovaries during menopause. This leads to many chronic problems in menopausal women. So today we'll discuss how diet can affect and help us prevent so many ailments occurring in menopause due to estrogen deficiency and other problems. Welcome. Starting our discussion on menopause and nutrition. As a woman ages, a number of factors can influence her nutritional status. As we all know, estrogen hormone levels fall as a woman ages. This leads to decreased metabolism. There are various illnesses and diseases that occur as a woman ages during menopause. She is on a lot of medications which affect her appetite, and she may not like eating food as she was earlier enjoying it due to bad taste of mouth and too many medications affecting the absorption of the food also. The woman may be widowed and bereaved. She may be in the depression or dementia, not able to cook as she was earlier doing it for her family and eating with her husband. So all these things lead to poor nutritional levels in a woman. The common diseases that occur during menopause are osteoporosis, that is, the bones become weak and she can have fracture on a minor fall. As the woman ages, she may have cancer. We have already talked about obesity and metabolic disorders during menopause. A woman, due to decreased metabolic rate, tends to put on weight around her abdomen, which can be prevented by mindful eating, exercise, and a proper diet. She may have high blood pressure and cardiac problems. So all these diseases can be prevented if we have proper nutrition. Let thy food be thy medicine. We should have nutrition that helps to keep our eyes healthy, beneficial for maintaining healthy skin, protect liver from damage and ailments, reduce risk of cardiovascular diseases, lower risk of cancer, aid in digestion and weight management, rich in anti-aging and antioxidant properties, help treat vitamin K and vitamin D deficiency, which is very, very common, and reduce inflammation in tissues, muscles, and joints. We here have a list of food groups that provide energy-rich food, body-building food, and protective food. Under the energy-rich foods, we have carbohydrates and fats, whole grain cereals and millets, vegetable oil, ghee and butter, nuts and oilseeds. The bodybuilding foods are pulses, nuts and oilseeds, milk and its products, meat, fish and poultry. The protective foods are green vegetables and fruits, egg, milk, which help protect various ailments during menopause. The food provides the energy and nutrition for cell growth, maintenance, survival, and regeneration. So, what do we prescribe a menopausal woman? Her diet should have a rainbow colored plate. What do we mean by that? It means that the diet should include vegetables and tubers, fruits, grains, fish and seafood, egg, cheese and yogurt, nuts, seeds and legumes, herbs and spices, meat and sweets, and a good amount of water. Indian Menopause Society has modified Mediterranean diet which is recommended for all women in menopause. The Mediterranean diet states that we should have 4 servings of red meat monthly, 3 servings of sweets weekly, 3 servings of eggs weekly, olives, pulses and nuts 3 to 4 servings, poultry 4 servings, 5 to 6 servings of fish, and daily we should have 2 servings of dairy products, physical activity, olive oil, 3 servings of fruit, 6 servings of vegetables, and non-refined cereals and products. We should drink plenty of water, avoid salt and replace it by herbs like basil and thyme. Now, most of the patients during menopause and perimenopause complain of bloating. How to prevent bloating? We should eat appropriate portions of food as has been described in Mediterranean diet. Slowly add fiber to your diet, practice mindful eating, skip fizzy drinks, and avoid trigger foods and fast foods. Anemia is rampant in our country and it is very, very common in all age groups of women. The iron-rich foods are pumpkin seeds, collard greens, all green vegetables, tomatoes, broccoli, kale, spinach, and quinoa. Now, one important point about anemia is we should cook our food in an iron utensil. Add lemon to your food for better absorption. Avoid tea and coffee when you are eating food. Cancer is very common after menopause. Now, 10 foods that help to reduce cancer risk are onions, garlic, apples, tomatoes, flax seeds, berries, leafy greens, cruciferous vegetables, carrots, and omega-3 fatty acids. Another common condition that occurs during menopause is diabetes. The anti-diabetic vegan foods are again berries, flax seeds, apples, turmeric, tomatoes, cruciferous vegetables, olive oil, nuts, citrus fruits, and leafy green vegetables. Menopause due to metabolic syndrome leads to heart problems. The other conditions which precipitate heart problems in a menopausal woman are high cholesterol diet, stress, smoking, and sedentary lifestyle. So preventing heart disease naturally is recommended for all women. Avoid eating industrial vegetable oils, eat less sugar, eat nutrient-dense foods, eat fermented foods, eat green vegetables, maintain a healthy weight, and visit to the doctor for health checkup on regular basis. Osteoporosis, as seen, is a silent killer in a woman of menopausal age group. Foods that treat osteoporosis and promote strong bones are pineapple, almond milk, coconut oil, prunes, apples, sesame seeds, leafy greens again, and omega-3 fatty acids. We have a separate webinar on this as it is a very important topic later on in the series. We have seen in a second series that metabolic syndrome occurs due to high blood pressure. The food that we can eat to avoid high blood pressure are berries, oatmeal, dark chocolate, leafy greens, garlic, red beets, yogurt, and salmon. The foods to be avoided in high blood pressure are red meat, fast food, margarine, whole milk, canned tomato products, bacon, table salt, and sweets. Let's have some general tips on nutrition. Now, variety in food is not only the spice of life, but also the essence of nutrition and health. A diet consisting of foods from several food groups provides all the required nutrients in proper amounts. Cereals, millets, and pulses are major source of most nutrients. Milk, which provides good quality proteins and calcium, must be an essential item of the diet, particularly for infants, children, and women. Oils and nuts are calorie-rich foods and are useful for increasing the energy density. Vegetables and fruits provide protective substances such as vitamins, minerals, and phytonutrients. Diversified diets, the judicious choice from a variety of food groups, provide the necessary nutrients. So as we have seen that osteoporosis is a silent killer and is a very important condition to be taken care of by nutrition from a very young age, calcium is present in the bone. So here is a list of foods which are rich in calcium and can prevent osteoporosis. It has an effect on cardiovascular system, nervous system, and muscle. On average, only 20 to 40% of calcium one eats is absorbed, and this decreases with age. Other factors that inhibit the calcium include lack of exercise, medicines, drugs, smoking, caffeine, and stress. A lack of nutrients also reduces absorption of calcium, especially vitamins C, D, and K, as well as the minerals magnesium and phosphorus. So drinking a glass of milk or popping a calcium tablet is not enough to prevent bone loss. This is why a healthy, balanced diet is so important. Now, another two tips which I would like to add here is calcium is absorbed well if you add lemon to your food. The other important point is if you don't exercise, even if you have a glass of milk, yogurt, or calcium tablet, it doesn't reach the bones. So it is very, very important that we include, besides a good calcium diet, exercise, and vitamin C while we are eating the food. So 5 foods which are really rich in calcium are 100 grams of poha, which has 600 milligrams of calcium, buffalo milk, which has around 520 milligrams of calcium, and cow milk and curd, which has around 300 milligrams of calcium. So moving on to another element, that is magnesium. It helps to combat menopause-associated conditions like osteoporosis, fatigue, type 2 diabetes, coronary artery disease, anxiety, and depression. So few foods which are rich in magnesium are black beans, broccoli, halibut, peanuts, spinach, and tofu. Now coming on to antioxidants, you must have frequently seen when you go to a doctor, they usually prescribe antioxidants or vitamin capsules to you. So what are these antioxidants? Antioxidants provide protection from free radicals produced in the body daily. These free radicals produce disease and accelerate aging. They even cause cancer and infertility. These are triggered by automobile emissions, tobacco, alcohol, and emotional stress. Now, certain vitamins, minerals, and bioflavonoids are important antioxidants. Example, vitamin A, C, and E. Folic acid, zinc, selenium, copper, and bioflavonoids like lycopene and carotene. Lycopene is beneficial to menopausal women. It protects the woman from increased risk of osteoporosis, heart attack associated with menopause. Now, the foods which are rich in antioxidants and lycopene are bright yellow colored fruits and vegetables like carrots, tomato, papaya, orange and mango, watermelon, pink guava, and apricot. Green leafy vegetables like methi and spinach, red wines, tea, soya beans, cabbage, and strawberries are very rich in antioxidants. Therefore, the concept of a rainbow-colored plate while you're having your meal is very, very important. Now, another thing that I would like to talk about is phytochemicals. What are these? Phytochemicals are present in many fruits and vegetables. They prevent cancer, hypertension, and heart disease. 4 to 5 servings of fruits and vegetables like broccoli and other cruciferous vegetables are associated with reduced cancer risk. Tomatoes are very rich in lycopene, and which is a potent oxidant. It helps in strengthening the immune system and has disease-fighting ability. Cooking of tomatoes in curries, soups, or ketchup liberates this component even more, making it more effective. Citrus fruits are protective against a variety of human cancers. The probiotics, which you find in huge amount in curd, is good for the prevention of certain cancers, anti-inflammatory, GI disorders, and boost immunity. Strawberries too fight cancers, heart disease, and are health boosters. Cocoa is called the superfood. It is anti-aging, protects us from heart disease, acts as stress busters, lowers the blood pressure, and improves insulin resistance, thus reducing cardiovascular disease or heart problems. So what are the vitamins that are indicated in a menopausal woman? Vitamin A is necessary for the health and growth of the skin, eyes, and mucous membranes. Vitamin B complex and folic acid are beneficial during menopause. It helps to prevent precancerous changes in the cervix. They help us to handle sugar, maintain health of the liver, and stabilize brain function. Vitamin C is the healing vitamin. It is very helpful during menopause. It helps to mend wounds and burns and maintains collagen. Vitamin D, along with calcium and estrogen, is essential for the ongoing strength and maintenance of bone mass and to minimize the risk of osteoporosis as we get older. Vitamin E is sometimes called the menopausal vitamin because it may have chemical activities similar to estrogen, which a menopausal woman is deprived of. So what are phytoestrogens? There are certain foods which contain phytoestrogen, which mimics estrogen in our body. So as we all know that during menopause, estrogen hormone is reduced. So if we take these foods and include them in our diet, it will help us reduce the symptoms and sufferings of menopause. There are certain vegetables like carrots, fennel, garlic, and onions, quinoa seeds, rice bran, seeds and nuts like almonds, flax seeds, walnuts, fruits like apple, cherries, and grapes, and soy foods like tofu and soya beans, which are very rich in phytoestrogens. So in our intake of food, we should include all these in large amount to prevent the symptoms of menopause. Now for women who are overweight, what is recommended is eat breakfast like a king, lunch like a prince, and dinner like a pauper. Small frequent meals at regular intervals should be taken. Gap between two meals should be around 3 to 4 hours. Regular breakfast plays a significant role in effective weight control. People who skip breakfast had higher mean BMI than those who do not skip breakfast. Breakfast skipping leads to excessive imbalanced eating later in a day, a dietary pattern associated with obesity. A healthy regular breakfast should be an essential part of a meal plan. So now this is a very important slide as shows nutrition plan for an adult sedentary woman. We have so many old women in our home who cannot move around and are bedridden. For them, the Menopause Society recommends cereal and millets of around 270 grams per day, pulses around 60 grams, non-vegetarian food of around 30 grams, vegetables of 300 grams per day, fruits 100, dairy products 300, fats and oils 20 grams per day, sugar 20, salt 5 grams, and 8 to 10 glasses of water. Now, foods which help in the condition of a sedentary woman are carrot, tomato, cucumber, pumpkin, green leafy vegetables, and yam, fruits like apple, plums, and papaya, walnuts, almonds, and cherries, garlic and methi, full grains like barley, wheat, ragi, sprouts, rajma, and bengal gram. Low-fat milk, curd, paneer, soy milk or soy food should be included in the diet. Fermented products like idli, dokla and brown bread are good for health. Foods that should be eaten in small quantities for these women are ghee, vanaspati, butter, pickles, papad, chips, and sweet, as they are very rich in salt as well as fat. Excess caffeine should be avoided. Processed, canned, frozen, and packed food should be avoided completely in a sedentary woman. Here are a few cooking tips and methods of cooking. Wash vegetables before cutting and preferably cut in long pieces. Do not soak in water for long. Use only sufficient water for cooking. Cook food in vessels covered with lids or slow fire. Prefer pressure, steam to deep frying and roasting. Avoid use of baking soda and artificial colors in food. Do not reheat the leftover oil repeatedly. Fermented foods like idli, dosa, dhokla, and sprouts improve digestibility and improve vitamin C and B complex absorption. Correct cooking methods could minimize intake of fats in diet. In order to minimize dietary fat intake, deep frying of food should be avoided. If such a cooking method is unavoidable, then methods such as using a blotting paper should be employed to drain out the excess oil of the fried cooked food. Instead, roasting or grilling not only eliminate added oil, but may also allow any fat already present in the food to drip away. Hence, the following methods are recommended: boiling, steaming, roasting, grilling, stewing, broiling, or making saute and poached preparations. So these are the cooking methods and tips for healthy cooking in menopause. As we know, the metabolism rate of these women are low. They tend to put on weight around the abdomen, and there are chances of developing metabolic syndrome, that is central obesity, high blood pressure, and diabetes. So nowadays, eating food outside and ordering food from Zomato and Swiggy is very, very common. So eating behaviors linked to overweight, obesity, and consequent chronic diseases include snacking, eating frequency, binge eating patterns, and eating out. While ordering food from outside, choose healthy snack options. Follow the healthy dietary guidelines as above while eating out. Smaller sized portions should be preferred over larger. Avoid sweetened carbonated drinks and commercially available high-calorie drinks, and opt for beverages like buttermilk, coconut water, fresh lime with water, etc. So now let's sum up what a healthy diet means during menopause. So we should use mixed protein. Adequate intake would be around 1 gram per kg per day. Eat 1 to 3 serving per week of oily fishes like salmon, mackerel, etc. Drink 8 glasses of water every day. Foods that are rich in phytoestrogens, which include lentils, kidney beans, and Bengal gram in soya, should be included in large amount in the diet. Add powdered flax seeds, cinnamon, fenugreek, soft in salads and curds. Include whole grains like beans and lentils daily. Diet should be balanced and nutritious. Daily calorie requirement is around 2000 calories for sedentary work, 2230 calories for moderate work, and a little more calories for heavy work. The diet should contain about 50 to 60% of complex carbohydrates, and high fiber content should not be more than 30%, and saturated fats should be less than 10%. Protein content of the diet should be around 15%. Eating a good breakfast is important. Have about 100 grams of fruits and 300 grams of vegetables. Prefer whole fruits versus juices, as juices take out the fiber and are very high in sugar content. Now coming to the most important part, that is snacking. Snack on 2 to 4 nuts like almonds, walnuts, or dried fruit like dates, figs, apricot, and seeds like pumpkin and sunflower. Add powdered flax seeds, cinnamon, and fenugreek and soft in diet. Limit use of cooking oil to 0.5 liter per person per month, that is 2 level tablespoons per person per day. Use combinations of 2 cooking oils. Choose from rice bran, safflower, sunflower, mustard, till, and groundnut. Olive oil, ideally in oil rich in MUFA, rich bran, groundnut, and olive oil with an omega-3 rich oil. Or blended oils. Limit intake of tea and coffee to 3 cups a day. Nutrition plan for an adult sedentary woman has been discussed in detail. So food source per gram per day should be cereals and millets, pulses, vegetables, salt, and 10 glasses of water. So consume a minimum of 500 to 600 ml of milk or curds, low fat, to build on calcium bank in bones. Support it with lots of vitamin C rich fruits, vegetables to favor calcium absorption. Limit consumption of sugar, which only has empty calories. Use iodized salt and limit intake to 1.5 teaspoons per day, that is 3 to 5 grams. It will prevent bloating as well as hypertension and weight gain. One has to be careful in using natural remedies marketed as dietary supplements, as they may cause more harm than benefit. Thank you so much for your patient hearing. Hope this diet plan helps you in every way. So our next topic on the series will be exercise in menopause. Thank you so much.